Hey friends, it's Allison here, jumping in real quick before you get into all the juicy details of today's episode. Did you know there is just one more week left to our 200th episode giveaway where you have the chance to win a full ride scholarship to the Better Belly Blueprint? This is the way to heal your gut so that you can poop daily, ditch acid reflux, and balance your hormones even when nothing else has worked. Here's how you can enter. Leave a rating and review on the Better Belly podcast on Apple Podcast or Spotify between now and May 29th. Take a screenshot of that rating and review, then go to betterbellytherapies.com/giveaway and fill out our 200th episode giveaway form. You will automatically receive an email with a code for $200 off the Better Belly Blueprint, which you're going to get as soon as you send in that form. And then a full scholarship winner is going to be announced on May 30th and messaged by email. If you win, you're going to win a full scholarship to the Better Belly Blueprint. And if you don't win, you can still get $200 off, which is 20% off of the Better Belly Blueprint if you join by May 31st at midnight. So go ahead and leave a rating and review. Get that giveaway form filled out at betterbellytherapies.com/giveaway, and you can finally end your constipation, acid reflux, and PMS for good. Craniosacral therapy and visceral manipulation are two hands-on manual therapies that we offer in the Better Belly office in Ann Arbor, Michigan, our in-person office. Craniosacral therapy and visceral manipulation have been used for a long time to help with a variety of problems and symptoms, including neurological problems, headaches and migraines, low back pain, movement problems, and has been used by people like PTs, chiropractors, doctors of osteopathy to help heal the body for decades. At Better Belly Therapies, however, we have been applying them very specifically to help our clients with gut health problems. And if you're listening to this episode, you found the episode because you've either found our office in Ann Arbor and we have forwarded this email to you or this podcast to you and to share with you how craniosacral therapy and functional medicine work together, or two, you're looking for solutions to your bloating, constipation, acid reflux, difficulty swallowing pills, etc., and you're wondering if craniosacral therapy and visceral manipulation are right for you. Maybe you've heard of craniosacral therapy and visceral manipulation before, and you're looking for more information on them. Or maybe you've never heard of these before, and you've been following our podcast for a while, and you're like, Allison, what are you talking about? What are these therapies? Which one do I need? Do I need one at all? And how do craniosacral therapy, visceral manipulation, and functional medicine work together? I'm going to talk through this and more on today's episode because what I've been finding and something I'm so passionate about is giving women and men as many tools as possible to help create wholeness and healing in their bodies. And while functional lab testing and talking about the gut and the microbiome and all these things can be so powerful, and we love talking about on this podcast, the other reality is that doing these hands-on therapies have changed my life, and they've changed the lives of many of our clients. So I want to talk with you today about how craniosacral therapy and visceral manipulation can work together with your functional lab testing to get you to the next level in your gut health. Welcome to the Better Belly podcast, where we find freedom from food restrictions, we increase energy in our lives, and we begin to feel more healthy and vibrant than ever by finding the root causes of our health problems. My name is Allison Jordan. I'm a marathon runner, functional medicine health coach, certified craniosacral therapist, gut health nerd, lover of Jesus, and owner of Better Belly Therapies, a clinic based in Ann Arbor, Michigan that works with both virtual and local clients to help them achieve the best health of their life. I am here to walk with you on your journey to a better belly and a better life. We're going to go beyond popping a probiotic and just checking out our poop. In this show, we are going to go deep into gut transformation strategies that last for your entire life. If you are ready to feel your best, get ready to roll. you are in the right place. And just as a reminder, this information is not meant to diagnose, manage, or treat disease. Always consult with your own health practitioner before you make any changes to your health. All right, guys. Well, I've been very excited to have this podcast episode out for a while now because we get a lot of clients who come to our office or they learn about our office for our local clients, maybe through Google or through a referral. And then they come onto their website and they're like, what are these people doing with gut health? Because a lot of times when people first think of gut health, maybe you're listening to this and someone said, oh, these people help with gut health. And you're like, okay, you maybe thought of helping with food sensitivity testing or diet change or meditation, or you might not even had been fully sure what is done, maybe supplements or something like that. But one of the things that we do at Better Belly Therapies that's so unique and that actually gets our clients changes is that we have a couple different therapies we use that not a lot of people use that make a huge difference. Two of them are craniosacral therapy and visceral manipulation, which are done in our office. They're hands-on therapies where you come in, you can receive it from a trained practitioner who works with your body. And we're going to talk about, what craniosacral therapy, what systems of the body it works with, same with visceral manipulation, why someone might need it, some of the symptoms you might have if you need these things. But then we also can offer to our clients functional lab testing on top of it through our Foundations program and through our Whole Body 360 program, which combines our craniosacral therapy and visceral manipulation with functional lab testing. And functional lab testing works on a different side of the body. If I were to describe the two different kinds, and the reason that we offer these two different things is that we have our physical structural body, which is made up of our ligaments and our muscles and our organs and our fascia and all the ligaments that are like all of our organs have these seat belts that actually plug into our body. And if any of these seat belts or fascia get restricted, your organ health reduces in its functionality. If your nervous system, such as your brain, your meninges, your spinal cord, your cerebrospinal fluid get restricted from car accidents or falling off a horse or falling on your tailbone or collisions in sports, things like that, then you're going to have a impeded connection from your brain and your nervous system communicating to your gut and vice versa back up the line, your gut communicating back to your brain. And so sometimes our clients come in and the clients that we work with actually have a structural physical tissue restriction that's impeding their gut health, that's actually causing things like acid reflux or bloating or constipation. We can have scarring from things like gallbladder removal or hysterectomies or having a removed appendix. All these things are going to be impacting overall gut health, which might just feel like, I just don't feel comfortable after I eat, but could actually be a physical restriction. On the same side, we also have biochemical problems. So that's, the molecular invisible side of things where it's pathogens. We're thinking about heavy metals. We're thinking about your liver's ability to detox. We're thinking about hormone balance. We're thinking about thyroid. We're thinking about all these different things that craniosacral therapy and visceral manipulation, they can't help. But you can do functional testing and then take specific steps to help the body learn how to detox or heal the liver or get rid of pathogens using supplements or using a variety of supportive lifestyle changes, diet changes, things like that. And so you end up getting this whole picture where people aren't just, you're not just banging your head against the same thing trying to fix a problem over and over and over again. Like, if I just get the right food, if I just, I must have eaten something wrong or I was too stressed or didn't sleep right. And those are not the problems. Everybody should be able to cope a certain amount with stress and with sleep changes, etc. But when you're really, really sick, what I call when you're depleted, right, you lose that margin. And our job and our goal at Better Belly Therapies is to figure out for clients that we work with in person and virtually, what do they need? Is it more of a craniosacral therapy, visceral manipulation thing? Do they even need functional lab testing, and vice versa? Do they only need functional lab testing? And then will they maybe need both? And that is where the combination of the two come in. And even for our clients who we work with across the US or in Canada, we sometimes help them find craniosacral therapists and visceral manipulation practitioners to work with so that they are healthy and happy and actually get the results that they're looking for from their work with us and from their intentions, so that they can get results, have energy, re-enter their family, all these great things. So without further ado, what is craniosacral therapy and visceral manipulation? Just a quick overview. They are gentle manual therapies. So it's not like deep tissue massage. People aren't poking around in your belly like some aggressive, like needle sticking with your fingers or something. It's really gentle manual therapies. Often you're fully clothed doing craniosacral therapy. Sometimes you might lift up the shirt just to reveal the belly for visceral manipulation. It's in a really comfortable, warm setting, at least in our office. The two techniques work with, one, your fascia around your nervous system and the bones around the nervous system. So you're thinking nervous system, brain, spinal cord. You have 22 cranial bones that all actually move a little bit. So around their sutures, right? So if you think about the face and the skull, it's not just one piece of bone, but there's 22 of them, and they all they open a little and then they close a little. And that helps the cerebral spinal fluid flow, which detoxes the brain and provides nutrients to the brain and gives the brain buoyancy. So it protects it from just like our everyday moving our heads around and funny stuff like that, let alone bigger accidents. That's what craniosacral therapy works with. It works from the head, down the spine, to the sacrum, at the pelvis. So pretty far distance, really looking at, can the body create a healthy cerebral spinal rhythm of having basically the breathing mechanism of the brain, right? If you can't breathe, you're going to have a problem. You're going to feel like maybe achy, like someone's holding down one of your ribs or something, but you're also going to feel like you can't get a full breath. You're having to work really hard to breathe. You're kind of tired. You feel maybe faint because you're not getting enough oxygen. And the same thing can happen to your brain. If you're breathing, even if you're breathing fine, that your brain can actually have impact, and we call them compression and adhesions, where it's not getting enough blood flow. It's not getting enough cerebral spinal fluid flow and circulation. And it's really going to cause problems in things like your mood. It's going to cause problems in things like pain, your motor skills, balance, vertigo is a really common problem. Eye motor problems, headaches and migraines, memory, recall, word recall. I already said mood, but really seeing people with anxiety, seeing people with learning disabilities. And the craniosacral therapy itself was developed by Dr. John Upledger, who's a doctor of osteopathy and a researcher at Michigan State University. And you can read more about his discovery and development of craniosacral therapy in his book, The Inner Physician. It's a super readable book. It's like not a textbook, but his initial work and research with craniosacral therapy was with children with autism or on the autism spectrum and with children with learning disabilities. He was very interested in how physical restrictions could be impacting these children's well-being, everything from their, autism, having this problem of children banging their heads on the tables or biting things, and then learning disabilities, just having a hard time focusing, being stuck at certain reading levels, or anger problems that he worked with children with, all sorts of stuff. And his initial work was so profound that he ended up doing more research on adults, teaching parents how to do craniosacral therapy on their children, teaching other health practitioners how to do craniosacral therapy on their patients and clients. So that was developed by Dr. John Upledger. And again, craniosacral therapy works around the brain and the spinal cord, the bones around the brain, so in the skull. And then something called the meninges, which I like, if you've ever heard of meningitis, it's this infection that can happen in the brain and spinal cord where the meninges get basically either a bacterial or a viral infection. And aside from meninges though, or meningitis, lots of problems can happen with meninges. Because sometimes if you get into things like epidurals, they puncture the meninges and they can cause scarring and torsion and torquing of that meninges, where it's not as flexible anymore. Initially, craniosacral therapy can help with that, but that is a problem that you can develop. We see people who've had sports injuries and collisions, everything from like diving for a volleyball to being run into as a soccer player to, of course, the classic football, because the Upledger Institute, which Dr. John Upledger founded, did end up working with the NFL with dozens of their NFL players, especially actually post them being athletes. Just once they had retired, they worked with all these NFL players on their pain levels and their mood and their sleep quality. Sleep can be really impacted by craniosacral therapy, chronic fatigue, things like that. And so he started with children, worked onto adults, and really just developed this profound research on craniosacral therapy, the craniosacral rhythm, where it comes from, etc. And now that can be taught to a variety of health practitioners. And then visceral manipulation works with organs, the fascia around organs, and then the what we call visceral ligaments, the ligaments that tie organs into their space. It's it's the reason why your liver is currently not in your pelvis, right? Right. So you've got this, like your liver, for example, it's a big organ. It hangs out kind of behind your rib cage on the right side. The majority of it is going to be on that right side. So if you feel your rib cage, you're like, well, why isn't the liver down in my pelvis right now? That's because of ligaments holding them in. And like I said, there are these seat belts that are designed to just like a seatbelt, it's designed to let you move a little, but if you move too much or too fast or in the wrong direction, it's going to tighten. Designed to protect you, but I mean, once it's done protecting, or if you don't need it to protect you, it can be really annoying if you accidentally activate that seatbelt locking mechanism. And oddly enough, that same function can happen in our visceral ligaments from falls and car accidents. Actually, speaking of car accidents, because when you stop moving, when the car stops moving, you keep moving. Once you stop moving, your organs keep moving, right? So if you can imagine that kind of physics, layers upon layers, and those organs, they don't like that, and they can get really tight. Abdominal surgeries can cause major problems in viscera, everything from like just the organs being exposed to air can be very straining to the fascia and to the organs. It can make them kind of stickier, as in like tackier. They don't glide as well. They can become adhesed to each other more or less. But then even where the abdominal surgery was it a gallbladder removal? Was it a hysterectomy? Was it appendicitis? Was it a polyp? What was it? What was removed? What had to be cut through to get there? And what are the problems that have come up since then? And visceral manipulation was developed by Dr. Jean-Pierre Barral. He's a PT and a doctor of osteopathy from France, and he ended up partnering together with Dr. John Upledger to create the International Alliance of Healthcare Providers and Healthcare Educators, where it's this umbrella institute where they really teach people and teach health practitioners a wider variety of techniques that are not being taught in your average like PT school or, occupational therapy school or chiropractic school. So these are extra, more or less, techniques that aren't being taught in basic curriculum, but are so powerful and so meaningful. And so you do get handfuls of PTs or OTs or chiropractors or massage therapists or what have you out there who know these techniques, but not necessarily everyone does, and not everyone uses them in the same way. Some really impressive things about, visceral manipulation is, for example, one of the main instructors for visceral manipulation, her name is Dr. Gail Wetzler. She is currently on the Women's Health Task Force for the United States Olympic and Paralympic Committee. And so this is an executive team consisting of 10 doctors and 4 Olympic female athletes to really advocate and develop resources on how female athletes can continue to stay healthy and be healthy even as they have kids, or even as they, are trying to get pregnant. How can they be fertile? How can they have strong bodies and be able to perform as top athletes. And so Dr. Gail Wetzler is she's a PT, and she's one of the leading visceral manipulation practitioners in the Brawl Institute, has really developed a lot of curriculum and teaching for that. And so again, if you're kind of like, is this, are these voodoo or like just like really weird therapies that are like, I don't know, I'd like to say like energy based, or they're all in your head. No, they're actually incredibly anatomy based. I mean, if you go to these courses, your brain is put through the ringer for all the anatomy that you are required to understand, and that you have to understand to be able to do the techniques well, and to understand how all the organs work together and how to safely and effectively treat them. So to be trained in visceral manipulation and craniosacral therapy, there's 4 main courses each. So 8 total. It takes an average of 2 to 4 years just to complete 4 classes. I busted my butt and got it done in about 3 years to complete all 4 classes, except for COVID. Cut off one class at the tail end that I had to wait a while to finish. But you can get additional testing and certification in craniosacral therapy. I'm a certified craniosacral therapist that involves essays and exams. So there's different levels also of practitioners and how skilled they are. So people who can learn craniosacral therapy and visceral manipulation, I already shared a little bit, but massage therapists, PTs, OTs, nurses, doctors, chiropractors, acupuncturists, basically anyone with a license to touch. And how that person uses these skills can vary on their training, their philosophy on the body, maybe regulations or limitations set by insurance if they're working with insurance, the skill level, and their dedication to studying anatomy straight up. Because not everyone who does craniosacral therapy and visceral manipulation will do it equally same way, or some will have a particular interest in certain maybe areas of the body or impacts of the body. So how we work with craniosacral therapy and visceral manipulation in the Better Belly Clinic is really based off of what problems our clients come in with. A lot of times it is gut health problems. It's bloating, it's acid reflux, difficulty swallowing pills, neck pain, headaches and migraines, TMJ. TMJ is a really big one and common with gut health problems, let alone just common in general. Pelvic pain. A lot of women who have had pelvic pain either before, sometimes related, sometimes unrelated to pregnancy and giving birth, and they've gone to pelvic floor therapists, and because those therapists didn't have visceral manipulation training, they kind of missed some of the restrictions going on in the body. So they've had ongoing incontinence or ongoing pelvic pain or ongoing, painful sexual intercourse. And so we can use craniosacral therapy and visceral manipulation to help all these sorts of problems, chronic fatigue. We've helped with so many different things. It's really been so cool. But how we use them is based off of each person and what they're presenting, what their main concerns are, symptoms are, also what their health history is. Like, have they had a history of car accidents or concussions or surgeries or pregnancies or what have you? We're really interested in what are our clients' health histories, and do they look like, does it look like you need more craniosacral therapy and visceral manipulation, or does it look like you need more functional lab testing and biochemical work to look into, pathogens or heavy metals, things like that? Or do you kind of need a little bit of both? And so we evaluate our clients physically when they come into our office, doing something called general listening, local listening, range of motion, fascial gliding, looking for where fascia is stuck or where it stretches appropriately. Fascia, it's kind of like pantyhose. It really should stretch in every direction. And if it gets stuck, it might, if it's torn or knotted up somewhere, it might not move as easily or it might be twisted. And so we kind of look for that in people's bodies through moving arms and legs, and there's all sorts of fascial testing you can do. We look for the craniosacral rhythm. We look for, is it symmetrical? Like, same on the left and right side of the body? Does it have a good quality to it? Like, is it smooth or is it bumpy? What's its amplitude like? Is it strong? Is it weak? Does it get really big or is it kind of faint, like, almost like shallow breathing versus like being able to get big, deep breaths? What's the rhythm like? Is the rhythm fast? Is it really slow? Is it kind of uneven? That gets back to the quality. Craniosacral therapy, by the way, is not energy work. It is based in physical tissue. Same with visceral manipulation. Physical tissue that has real anatomical and physiological motion to it, just like your lungs have physiological motion to them. Like it's not just some kind of, we're making this up in our head and we're just moving energy. Right. So it's not the average training of a PT, chiropractor, doctor, etc., but it can be added on. And then some of the reasons that we see craniosacral therapy and visceral manipulation helpful for our clients, especially our clients who've been really, like, if you've already been to the chiropractor, you've already been to the PT, you've already been to the acupuncturist and all these other alternative methods, and you haven't gotten results for your main concerns. Maybe it's insomnia, maybe it's fatigue, maybe it's like kind of pelvic pain or low back pain or neck pain, whatever it is going on. What I found is that a lot of times the practitioners that you were working with were really looking at muscles and bones, which are important, but organs and fascia actually command the body way more than muscle and bones do. Organs in particular, I want you to think about the fact that, your heart, you can't live without your heart or your esophagus or your liver. If these things really start to fail, you're going to have problems. If your esophagus is having problems, it's really hard to eat. If your stomach is having problems, it's hard to digest. If your liver, heart, that's a big one. And we can get all these people who maybe you don't need heart surgery, but the heart is having problems. And it's manifesting in POTS syndrome, postural orthostatic tachycardia syndrome, or it's manifesting as like weird arrhythmias in the heart, or it's manifesting as difficulty doing cardio exercises, or it's manifesting in kind of just really fast heart rates for no reason sometimes. So imagine that your organs are really important. Well, your bones, literally their purpose is just to get you moving in life, like get you up out of a chair and then out to protect you. Those are the two things. And even the movement itself, a lot of that's protection so that you can go and find yourself some food or run away from a predator, right? And so what Jean-Pierre Barral says is that the contents are more important than the container. The container is the muscle and the bone that kind of gets you places, but the contents are the organs and the blood and everything flowing through your body to give you consciousness and to give you nutrients and to give you oxygen, right? And to give you circulation. Those are your organs. And so the contents are greater than the container. And a lot of times you'll actually get muscular and skeletal problems because there's a visceral restriction, because there's a fascial restriction around an organ or around the nervous system. And so the whole body on a musculoskeletal level is actually going to torque itself to kind of compensate for that problem. And it's going to then therefore cause pain in the muscle. But your body's like, look, I prefer pain in my muscle and poor adjustment, maladjustment to my vertebra. If you keep going to the chiropractor and you keep needing the same adjustment over and over again, a lot of times it's a visceral restriction that is pulling that bone out of place. And we actually work closely with a chiropractor. I don't know what episode number it is, but we can put it in the show notes where I actually interview the chiropractic office that we partner with, and we refer a lot of clients to their office. They refer a lot of clients to us, and we end up working together to help those clients achieve optimum levels of health and movement and functionality and a pain-free life by making sure that they're both viscerally and craniosacrally released and then also musculoskeletally balanced. So some symptoms that we work with, symptoms that we often reduce and expectations you can have if you get craniosacral therapy and visceral manipulation. from a qualified practitioner, you can often see improvements in swallowing. We get clients who come in, they can't swallow a single pill, right? They have to, either everything has to be in powder format, or it has to be all baby pills or something. They can't swallow, right? And there's just restrictions all up and down their esophagus and into their stomach. So they have swallowing problems. They often have acid reflux problems, can be a physical visceral problem. Back pain because of the small intestines attaching to the posterior abdominal wall. Basically, your small intestines, where they anchor in, is right in front of the back of your spine. And so if you've had a restriction there, had problems there either in the past or currently, your small intestines can actually pull on your low back and create low back pain. And that was a problem even I had when I was going through my 2 years of debilitating GI problems, headaches and migraines, especially we even have clients who've had craniosacral therapy before they still have headaches and migraines. And we find that there's visceral restrictions like lung pleura ligaments attached to your cervical spine. You have heart ligaments that attach to your cervical spine, that's your neck. We have stomach, and then your esophagus can have a long chain fascial reaction, especially on the left side of your body. So if you have a lot of left shoulder, left neck tension, even maybe like left arm feels less flexible than your right arm, that can often be a restriction in your stomach and esophagus, or it could even be a restriction in the lung pleura and the lung on the left side. But extreme fatigue, overall body tension, eye fatigue, TMJ problems, low back pain, indigestion, and pain associated with scarring. So, we've worked with a lot of clients who've had gallbladders removed, or maybe almost needed a gallbladder removed, but then we worked with them and their gallbladder actually got unstuck because they had all these restrictions that we were able to release. But as far as number of sessions that it would take to experience benefits from craniosacral therapy and visceral manipulation, it really varies. Our sessions in our office are hour long, and we recommend them every other week when you're aiming for a therapeutic result. And then the number just varies a lot on what's going on in your body. How many restrictions do you have? How thick are these restrictions? How old are they? How many injuries or surgeries have kind of compiled behind these restrictions? Is there toxicity in your tissue, which will cause your tissues to change more slowly? And it is one reason that we really do see and end up referring clients to our Whole Body 360 program. So that's kind of what's going on with the manual side of things. We're able to change and do so much physically, and and you don't need to just go in and ram and just force something to release. It can be really gentle therapies again. So it's not like doing a deep tissue massage on your liver. That would be absolutely horrible. And you'd probably have some bruising afterwards. But then how and why we incorporate lab testing and refer clients to our Whole Body 360 program or Foundations program, this is a little different. So, you come in and maybe you've heard craniosacral therapy and visceral manipulation can help with your problems, your gut health problems, or your hormone problems, or whatever it is. And you come in, well, one of the things we are looking for is that enough? Because we're not just going to work with somebody and just throw some therapies at you and be like, hope it works. We're actually going to evaluate you and look for all the patterns and telling clues that we have of what's going on with you and what do you actually need. So a lot of times, if you are indicated to need functional lab testing and be in our Foundations program or a Whole Body 360 program, you're going to have a lot of food restrictions that are often worsening. You're getting more problems with that. You're having worsening allergies. You have skin problems like eczema, acne, rashes, psoriasis. You have sinus problems, just like chronic postnasal drip or sinusitis. You have acid reflux problems. Acid reflux, I've really found so many stomach restrictions in so many people, especially women who've been pregnant. Just the way the stomach gets really pushed up by the uterus. But then also if you have H. pylori on top of that, it's not enough to just give visceral manipulation to release the stomach. So you really want to check for H. pylori as well. If you burp excessively, really showing a lot more probably H. pylori going on, or potentially low stomach acid, but we really do see a lot of excessive burping with H. pylori. If you have UTIs one time a year or more, that is enough to say you probably have a microbiome imbalance that's now impacting your bladder or even your, vaginal health. So if you crave sugar or carbs pretty extremely, if you've been diagnosed with an autoimmune disorder such as rheumatoid arthritis, endometriosis, PCOS, Crohn's disease, ulcerative colitis, fibromyalgia, these are all autoimmune disorders we've worked with, both in craniosacral therapy and visceral manipulation, but especially with functional lab testing in our foundations program. So helpful to really do a clean sweep through the body and clean up all those biochemical toxicities that are flaring up these autoimmune disorders. So whenever we see these, these two things coming in, you have maybe a health history of like car accidents, and we do a physical evaluation, and we can really feel there's a lot of restrictions going on. They really do correlate with some problems. Maybe constipation can again be caused by like your large intestine having a restriction. Your large intestine has so many connection points to your rib cage, to your for women. There's a connection from your right ovary to your colon. There's a connection from your colon to your stomach, from your colon to your gallbladder. All these different things. So we're looking for restrictions everywhere in the body. If there is a restriction, we can physically evaluate that and feel it and even see it in the range of motion. And then we'll begin asking questions about food sensitivities and allergies and skin and sleep and hormones. Do you have PMS problems? Do you have a regular period? Were you ever on the pill? All these things that create this bigger picture for us. And when this happens, if we really do see both of these problems, we recommend our clients to our Whole Body 360 program to combine both the lab testing and the manual therapy to address multiple body systems, so that we actually can effectively reduce symptoms and not just kind of like almost like playing whack-a-mole, like one thing here, one thing there. We really want to change our clients' symptoms and their whole body, how they feel. And so if you come into our office, if you're a local client, if you're local to Ann Arbor, Michigan, Dexter, Michigan, the Washtenaw County area, even we've had some clients come in from Detroit or further away. That is kind of how we are working and what it'll be like for you to get an evaluation from us. If you are not local to us, but say you live in Arizona, you live in California, maybe you want to work with a craniosacral therapy and visceral manipulation practitioner, we will have a link in the show notes for how to find one near you using your zip code and the International Alliance of Health Practitioners, their website, which was developed again by John Upledger and Dr. Jean-Pierre Barral. And then, if you're also local, if you are not local to us and you want to work with us doing functional lab testing, our health coaches and our staff, they are trained to know how to find and look for somebody who has a craniosacral therapy and visceral manipulation restriction, how to help you find someone near you if that's relevant to you. So there's nothing holding you back. You can still work with us. If you are not local to us, then you will work with us in our foundations program. And we really love working with both our local clients and our virtual clients, and just working together with all the tools we have, because there's so many ways that gut health doesn't have to be, it doesn't have to be forever. It doesn't have to be something you're forced into, and you can actually choose to be out of it. It can be a choice, and you can choose health, which is what we are so passionate about here at Better Belly Therapies. All right, everybody. Well, I hope that was such a helpful episode in hearing about how you can combine manual therapies such as craniosacral therapy and visceral manipulation with functional lab testing to get an even better outcome in your health. You don't just need one or the other. Many times our bodies need both. They need multiple things because we have multifaceted bodies with multifaceted needs and multifaceted areas where things can get a little jumbled up and need some help and support. Well, if you love this episode, I just want to encourage you. We have so much more coming down the line. Subscribe so you never miss an episode. And if this episode made you think of somebody, I'd encourage you, take a screenshot and share it with that friend. I cannot count how many times when I tell someone I am a gut health therapist that they say, "Oh, I know someone who needs you." So send that friend a love note to their gut and do us a favor and pass this podcast along to them. Other ways that you can support us is by leaving a rating and review in our Apple Podcasts interface. We have a link in the show notes if you don't listen on Apple Podcasts where you can just click and leave a rating and review there. It helps other people just like you to find this podcast so that they can have better information as well and find healing for their gut. Other ways that you can stay in the conversation is by following us on Instagram and Facebook at Better Belly Therapies. I love connecting with our listeners there and just seeing how you guys can be served. How can we answer questions for you, and what more are you looking for in your health? Other than that, I just want to encourage y'all to remember our motto: miracles are immediate, but healing takes time.